Himalaya Wellness Company. This is the first of all, I would like to extend my thanks to the organizer for giving us the opportunity to present one of the research. Of course, it is not a hardcore dermatology research, but it is related to one cosmetic product, which is the flagship brand of Himalaya. That is Himalaya's Purifying Neem Face Wash, PNFW, we call it is. So we have done a lot of research around this particular product. And earlier also a very big robust study was done at par with the other allopathic medication for acne. And that was published in a widely publication, Journal of Cosmetic Dermatology. And then other study which we have recently done and which we are privileged to present here. So here it is a study was like clinical study to evaluate the safety, in use tolerability and efficacy of PNFW in management of pimples. Pimples, I think there is no need to talk about what is pimple, what is acne. Everybody is aware this is a sebaceous gland uh, physiological phenomena. It is not a disease. When that is exaggerated, then it is a concern for the medical fraternity and the people who are suffering from it. When it is crosses and it is a lifestyle disorder, we can say. So there is a how to manage without medication when it comes to a lifestyle disorder. Of course, when it once it reaches to the incurable condition, it is troubling too much with the various complications. Of course, we definitely need to have a medical attention, and there is a definitely treatment lines are there. So this is a study which we conducted for PNFW face wash. The objective was whether our product helps in the prevention or reduction of the acne. And as we say that it is a face wash, we carried out the study only in the mild to moderate acne. The earlier study was done by considering the IGA investigator global assessment as per US FDA guideline for acne assessment. But in this study, which is the second, the counting was considered to define mild to moderate. So 0 to 5 pimples on one side of face, and 6 to 20 pimple on the other side of face. The study was done with all regulatory guidelines after taking the due approval from ethics committee, consent and everything. So this particular product was asked like 120 subjects were enrolled after screening of around 150 subjects. And then out of that 120 subjects, 114 subjects completed the study. And the study was like zero, which was day zero was a preliminary assessment, and the enrollment on the basis of the various inclusion and exclusion criteria. The people subjects were excluded on the basis of the some severe conditions, and otherwise if there is a fitting in the inclusion exclusion, patients subjects were enrolled, and the person was asked to apply the PNFW face wash morning and evening with the certain conditions, how to apply with the proper uniformity application morning and evening twice daily for 28 days. Assessments were done at the baseline after day 7, day 14 and day 28. The various assessments which was included in this clinical study was dermatological assessment for the number of pimple, for the color of pimple. So on the 9-point scale and 5-point scale, the typical instruments which are used for the assessment of acne was considered and taken into consideration, like sebometer for the sebum, moisturometer for the moisturization of the skin, tevameter for transepidermal water loss, TEWL, and then 3D analysis of the pimples for the area, volume, color. It was done through Antira 3D analysis. So these were the various strong parameters assessments through dermatological assessment, as well as instrument assessments were carried out in the study in 114 subjects who completed the study. So now we come to the result of the study through this graph. We can see here that when after applying the 28 days, of course, it was assessed after 7 days, 14 days, and after 28 days, the statistically significant reduction was observed in the number of pimples and the appearance of pimple. So total pimple reduction after 28 days after applying of the face wash, morning, evening, it was 75% reduction was noticed. So that was a very encouraging result. The pimple marks, in the second graph, which we can see, there were 61% reduction in the pimple marks was seen. And these were the cases where the subject had a prone skin for the pimple development on the basis of the sebometer. Sebum quantity which was the as per the global guideline, it is more than 150. This is the score. So all the cases were enrolled only when the sebum production was 150, more than 150 through sebometer. So those cases were enrolled, and here after applying we can see that 75% and the 61% pimple reductions were seen. Apart from that, we can see from the various instrument assessment, that was sebometer. So here we can see that after applying 28 days, there were 21% reduction in the sebum through sebometer. Other is very, very important and the sparkling feature. When we call for the sebum reduction, then it is obvious that we assume that there will be a dryness because sebum is causing the oiliness. It is assumed that there will be a dryness for the skin. But with this product, we could see through the moisturometer that there was a 32% increase in the moisturization. So this is a very good combination that we are reducing the sebum through this face wash, but simultaneously it is not causing dryness, although it is increasing the moisturization. So this is a different kind of feeling. So TEWL also was conducted. That was also the 22% improvement was seen in TEWL. Means water loss, it is preventing, improvement is there. Moisturization is improved, but the sebum level is decreased. So these combinations are giving a very, very good and favorable outcome for the people who are having the pimples mild to moderate. The other important assessment, which was very highly objective, highly validated, and accepted by the global community, that is the 3D analysis through Antira. And this is, we can see that through 3D, it is again the light marks, the volume, and the area of particular pimple, that the individual pimple was assessed, and we can see that total volume was decreased by 72% from the baseline after 28 days use. In the same line, the 53% area was decreased, and light marks, we can see it is increased by it is improved by 9%. So overall picture, if we can see from the efficacy point of view through dermatologist assessment, through various instruments, and the 3D analysis through Antira, it is giving a very, very favorable outcome. On the other side, this was the efficacy part. The safety part, there was no cases because it is a simple face wash. So there was no hypersensitivity reaction like redness, itching, dryness. It was not noticed by any of the subject participated in the study. So in nutshell, in the conclusion, we can say with the previous study that was published in the Journal of Cosmetic Dermatology and this new study, which was again done in a good number of subjects, like 120 subjects, we can say that PNFW, Purifying Neem Face Wash, is helpful in the management of the acne. It is helpful in reducing the number of the pimples. It is helping in the prevention of the recurrence through the various technical and the medical instrumentations. It is proved. So this is all about this particular study, and this was done last year, and we acknowledge our CRO who had conducted the study, and Himalaya being a proud partner of having this particular product in the market globally. Thank you very much.
Thank you so much,
Okay.
Dr. Rajesh.